Welcome to my series on demystifying the DSM, where I am going through each and every disorder throughout the DSM to kind of explain how we diagnose, how we treat, how we look at differential diagnosing, and how we make sure that, we're putting these things in the right categories and looking at them from a whole person. I am Christy Bundakumar, psychiatric nurse practitioner. I have over 20 years of clinical experience, but honestly, I feel like my real experience comes from just overcoming many tragedies and obstacles in my own life and having to navigate the medical community, the neurological medical community as a caretaker. So I've learned so much, not just about psychiatry professionally, but neurology, and they really do fit hand in hand. Right now we're going through a series or the chapter on somatic disorders. And factitious disorder is in this category. And we often talk about this as Munchausen's. Munchausen is actually a name of a person who was experiencing some of these symptoms. So the correct DSM criteria is, or name, title, disorder, is factitious disorder and factitious disorder by proxy, or Munchausen by proxy. So when we're going through the DSM, we know that there's always these criteria, A, B, C, D, and you have to meet these criteria for this disorder. So factitious disorder, criteria A is that there's a conscious falsification of a physical or psychological symptom. Now, this is different than somatic disorder. This is different than conversion disorder in that there is a falsification. They know they're not telling the truth, and oftentimes they are inducing that physical symptom. I've had patients drinking bleach. They don't come in telling me that they drank bleach. They just come in, oh, my chest is burning, my stomach is burning, I feel like I'm gonna die, right? But they drank bleach in order to feel those symptoms. So there's a consciousness to the falsification. Criteria B is that they actually present ill, impaired, injured. So you're seeing these people oftentimes in the emergency room, primary care, even specialists. If factitious disorder is their only diagnosis, they often are not in psychiatry, right? They are not going to follow up with those, or often don't follow up with those psychological referrals until they're at a point in their life where they want to change. Munchausen's by proxy, which is where there's that falsification of physical or psychological symptoms on someone else. We often hear about this where a parent is actually causing harm to their child so that they can bring them in, and attention is around that. So that there's factitious disorder and factitious disorder by proxy. And so either you're doing it on yourself or you're doing it to someone else. But either way, the falsification is conscious. They know that they're not ill. They are creating that illness. Criteria C is deception and without evidence of secondary gain. So I'm not talking about the person that's coming in, trying to get disability and, kind of falsifying information so that they can have a secondary gain, or someone who calls out sick from work and they're really not sick, right? This, there's no secondary gain to this. It's a disorder in and of itself. Criteria D is that it's not a delusional disorder, okay? A delusional disorder is where someone believes that they actually have these things. Delusions are false beliefs, and you cannot convince them that they're not real. It's not a conscious falsification. So you see how that is very different. That it's not a psychotic disorder. Psychotic disorders also have delusions associated with them, right? And so again, factitious disorder is a conscious falsification, but it's also not malingering. Malingering is kind of a faking, like I said, like to get out of work, or, there's some secondary gain there. Malingering is a falsification, but it's not to this point of factitious disorder. Like, this person will do whatever, including harming themselves, in order to be sick. It's not somatic disorder, and it's not conversion, and we talk about those in detail in other videos. So factitious disorder in the DSM is what the layperson might call Munchausen's by proxy. It's very disturbing when you see it. I saw a lot of this in the prison. I was working in the prison as a nurse practitioner. I was both a primary care and a psych nurse practitioner in the prison. And we would have things like somebody would get paper clips and put them into like a knot, but that would spring open. So it would be like this, and then they would swallow it. They'd have like 10 to 20 paper clips into this weird little contraption that they could swallow, that would then open up when it got into the stomach and cause an obstruction. That's factitious disorder. Okay? That was all for attention, for just the fact of seeking that medical care, and there's not a lot of secondary gain. That is factitious disorder. We hear about factitious disorder by proxy, Munchausen's by proxy, with children of very sick parents that are making their child sick, okay? And, if we suspect this, we should definitely be reporting this to protective services. And, but remember that the factitious disorder diagnosis is given to the perpetrator, not to the victim, okay? That it is a mental disorder of their consciousness. They are aware of it, and they are doing it on purpose, and they're falsifying, and they're injuring either themselves or someone else on purpose. So, we can talk about whether they're, also a personality disorder in that kind of especially factitious disorder by proxy. Do they have also an antisocial personality? And we'll talk about that further along in the Demystifying DSM series. But those things can be comorbid. You don't have to just have one disorder. But remember, if you have a delusional disorder or psychotic disorder, somatic or conversion, malingering, that is not factitious disorder. Those would need to be, treated very specifically. How would you treat this? I know you hear me say this over and over again, cognitive behavioral therapy, maybe even DBT, dialectical behavioral therapy, would be needed for this kind of factitious disorder. But being able to identify it, it's more than just a behavior. It is very much an illness of their brain and their mental illness. And I can give you another example. When I was working in the jails, and a guy had a pretty significant wound in his knee. He had fallen in the yard, and there was about 20 staples in his knee, and it just wasn't healing. So we got him where he was coming in daily for dressing changes. He was on antibiotics, but the wound would not heal. And so finally, we did an x-ray of the wound, which you don't normally do an x-ray of a wound. He was sticking things inside the wound, paper clips, pins that he saw, just whatever he could find, he was sticking that into the wound, so therefore it could not heal. That's, an example of a factitious disorder. Thankfully, I've never personally treated anyone with Munchausen's by proxy or factitious disorder by proxy. But again, it probably needs intense treatment, therapy, cognitive behavioral therapy, maybe some other psychodynamic, addressing any trauma. And, medication is probably not the answer unless there's a comorbid, depression, anxiety, right? This is really kind of around attention and there's a consciousness to the falsification. So very different from the other somatic disorders. But that is factitious disorder and factitious disorder by proxy. Not fun to treat, but again, getting in there with that cognitive restructuring, changing the way we think so that we can change the behaviors that we are doing. But like anything, the person has to be willing or want to. And this was my frustration with the two gentlemen that I discussed when I was working in the prison. They didn't want to get better. They didn't have any motivation to get better. And that's a hard place for us to be as clinicians, to want to be helpful, know that we could possibly be helpful, and the person not really wanting to get better. And that's the problem here with this factitious disorder, because it is a very conscious falsification. So that is our factitious disorders. Continue following in my Demystifying the DSM. I have another series going on about grief and lots of free content on the YouTube. So subscribe, get notifications, continue on your self-improvement journey.